Okay, we have to maintain patient safety and privacy. So our door is shut to do our privacy. I introduce myself to the patient. My name is Kristen. I'll be your nurse today. We're going to check her vital signs, her temperature, blood pressure, heart rate, and respirations. Let's see. Her birth history, we're going to say she's G1, T1, P0, A0, and L1. So we're going to do bubble, which is we're going to check her breast first. If she's not going to breastfeed, we don't want to touch her breast. We can educate on wearing a tight-fitting bra. That way that milk dries up. Also, there should be no nipple stimulation because that way the milk doesn't fill in the breasts. If she's going to breastfeed, then we need to check her nipples to make sure they're not cracked, they're not red, they're not inverted. We want to make sure the baby has a good latch. What else? There's no redness, swelling. What else? Mastitis, but most of the time that's not till after baby has begun to breastfeed. No engorgement. Let's see. So we'll go on to the uterus. You want to check mom's uterus, and it should be midline where the umbilicus is. So you're gonna hold the bottom with your non-dominant hand and then just kind of press and make sure that the uterus is firm. It shouldn't be boggy. It should be in the center. If it's not in the center, then it could be her bladder is full. So then we want to ask mom, when was the last time you used the bathroom? Was there any pain? Was it a normal amount of pee that came out? Did she have any trouble going to the bathroom? Let's see. So then we're going to check her bowels. We're going to listen for bowel sounds. We're gonna ask when was the last time she used the bathroom, to help promote going to the bathroom. She could get up and walk around, eat some fiber, and they may suggest a stool softener to make that first bowel movement easier to come through. Let's see, after that we'll do L, which is lochia, which we're just going to check mom's pad, and it should be the lochia rubra, which is going to be the bright red after she first has baby, and then it'll go to the lochia cerusa, which is like a lighter pink. But we want to check mom's pad to make sure that it's not excessive bleeding, that there's not big clots. We need to document how much blood is coming out, and the amount. So then we do E, which is the episiotomy or lacerations. So if she had an episiotomy, we want to check the incision, or if she had a C-section, we want to check that incision to make sure there's no like redness, edema, ecchymosis, drainage. Oh, there's something else. know it spells Rita, but I can't remember the A right now. Oh, approximation. So I guess the incision site. Let's see, then her, which is H. Drawing a blank. Hohenstein. Okay, so we want to check her legs, make sure, you know, one leg isn't bigger than the other. Like, we want to check for blood clots in her legs. Make sure there's no swelling. After that, we're gonna check on her emotional well-being. Does she have a history of postpartum depression? What else? Does she have baby blues? Is she bonding with the baby? Is she making eye contact with the baby? Is she feeding the baby and taking care of the baby? If not, then you can do the postpartum depression screening. And the last one is R for ROGAM. So if mom's blood type is negative and baby's is positive, then she has to get the ROGAM shot.